First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Another reminder, please take the online Learning Com evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I have placed the link of the Olete in the chat box. Another reminder, obtaining 50 Olete certificates will entitle one to a voucher for a free ROJoson telemedical consultation. A request that I'd like to make, please type your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face in the video. Okay, one. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer. Actually, I'm now on our 3rd year, on my 3rd year, but this will depend on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Epidermal Cyst in the Skin. The empowerment objective is for the lay people to have an essential understanding of epidermal cysts in their health management. The contents of this pep talk will be the following. What is an epidermal cyst in the skin? What is the hypothesized or theorized cause of epidermal cysts? What are the differences among the so-called sebaceous cyst, epidermal cysts, and acne? So these are the terms that you will be commonly be hearing from the internet, from doctors, okay? And where are the epidermal cysts commonly located? What is the most common complication of epidermal cysts if not removed, if not treated? How to recognize and diagnose epidermal cysts? And what is the treatment? And then the last topic will be, do epidermal cysts recur after an operation? So I'd like to have a disclaimer here. The ROJoson PEP talk contains my thoughts, perceptions, opinions, and recommendations culled from the experiences of myself as well as other professionals. Let's start with the first topic. What is an epidermal cyst in the skin? An epidermal cyst is a palpable mass. So usually it should be palpable. If it's not palpable, it's not, you don't suspect epidermal cyst. Palpable means that you can feel it through your bare finger, okay? Palpable mass located just beneath the skin. So this is the skin, and then it's located just beneath it, okay? That contains a capsule. This is the capsule, and inside of which the content here will be the cheesy, oily, greasy materials which we considered as skin element or keratin material or skin element. So ang itsura nito parang yung mga libag na on the skin on the skin that we usually rub. Okay. Now, in majority, 99% of epidermal cysts, there is a punctum, the so-called punctum. A punctum is a medical term that refers to it's illustrated here. It's a dark colored black spot, okay, which represents an opening. Usually it's a plug opening. So when the opening is released, it's open. Now here the punctum is open, then all the materials here can pop out. Okay. So to recognize epidermal cyst, usually there is a punctum. If there is no punctum, it may not be an epidermal cyst. It could be something else. So that's the basic definition of epidermal cyst. To repeat, it must be palpable. It's just beneath the skin, and then there is a punctum. Okay. So here shows the capsule containing the greasy, dirty. Okay. So try to imagine the libag that you have on the skin. When you rub your skin, may mga libag lumalabas, pero if it's many, kumpul-kumpulan, then you will see a grayish sila. Kung marami na, it will become oily and then parang dirty white substances. So what is the hypothesized cause? What is the cause of the epidermal cyst? Hypothesize means what are the theorized cause. So most epidermal cysts are caused by the implantation of the epidermal elements into the dermis. So here is illustrate a microscopic appearance of a section of the skin. This is the outer layer, the skin. Okay. And then here, this is most likely the punctum. Then there is an invagination, dead skin going in, okay, into the dermis. This is the dermis part. This is the epidermis, dermis, okay. And then, so when the skin cells from outside move underneath the skin surface, which is the dermis, okay, instead of, because it's implanted, it's trapped, okay, so it's not shed out, no. So these cells, when they went inside, they continue to multiply, and okay, because skin usually multiply every now and then. That's why we change. So we have some changes in the skin, may mga shedding of dead cells, okay, dead skin, okay. So then they form a wall. Ito yung wall around themselves. So this is what we call the capsule, and then inside this wall, they continue to secrete some normal skin fluids, which we call keratin. Okay. So here, to amplify this, this is the point of implantation of the epidermal, the skin element, the outer surface, into the punctum. This is the punctum, the opening. Okay, and then underneath, okay, they form a cyst, which is lined by epidermal, the skin element, okay, and then these are the substance, the so-called keratin content. Here it is, okay. Terminologies, I have to explain some terminologies because a lot of doctors often use the word sebaceous cyst, okay, and some would use epidermal cyst, but usually the correct term is epidermal cyst, especially if the cyst contains keratin substance. Then the proper term is epidermal cyst or epidermoid cyst or epidermal inclusion cyst. These three terms refer to the same thing. Pare-pareho lang sila, but it's not the same as sebaceous cyst. Kung sebaceous cyst, it contains sebaceous substance. Okay. But most of the cysts that you see are not really sebaceous cysts, but epidermal cysts. Okay. You might encounter the word milia. When you say milia, it refers to the very, very small, but still palpable, superficial epidermal cysts. Now, what's the difference between the acne? Acne and pimples are different, are not the same as epidermal cysts. Okay. So in acne, usually these are clogged skin pores. Okay. Whereas epidermal cyst, as we said, is an implantation okay, of the dead skin inside the underneath the skin. But acne means may clog yung mga skin pores. Some can lead to blackhead and then some whitehead. Okay? Tatanggalin na lang naman itong yung mga whiteheads, blackheads, wala ng problema. No? Whereas in the epidermal cyst, no, you have to remove the entire capsule para hindi umulit. Okay. Where are the epidermal cysts commonly located? Okay. The most common locations are on the face, neck, and trunk, but they can be anywhere, okay, as long as there's a skin element. Okay. What is the most common complication of epidermal cyst if not treated? Kung di tinanggal, mag-stay siya there, stasis, then it will become infected. No? So that's the most common side effects if not removed. No? Mag-i-infect lang siya. Okay. So, mamumula, tapos may nana, lumalabas. Okay. How to recognize and diagnose epidermal cyst? Okay. So, there must be a lump, no? Which is very superficial, mababaw lang, no? Just below, just beneath this, yung balat, no? Okay. The only break in the skin that you see is the punctum. Ito yung opening. But the rest will be inside that skin. Okay, then it can occur anywhere. Okay, so anywhere in the body, if you see a picture like this, okay, of different sizes, iba-ibang sizes, pwedeng maliit, pwedeng malaki, pwedeng sobrang laki, no? And then there's a mata or punctum, let's just call it mata, then you suspect epidermal cyst. So wag na kayo matakot, it's not cancer. Okay, epidermal cyst is benign. Okay. So what are the treatment options for epidermal cyst? There are three options. One is watchful waiting. The other one is the so-called incision and drainage. This is a procedure that you can do, an operation. And the other type of operation that can be done here is excision. When you say, most of the time, kung maliit lang yung mga epidermal cysts, as I said, it's not cancer, no? And it's very small. You can just leave it alone if it's not bothering you, okay? If it does not cause any discomfort or cosmetic problem. No? Usually, kung maliit naman, wala namang masyadong discomfort. But if it's located in an area, in the face, ganon, it might cause cosmetic problem. In which case, you may want to have it removed because of cosmetic problem. Pero kung maliit lang, pwedeng iwanan na lang, especially if it's located yung mga hidden areas na nakatago sa damit, pwedeng wala na. Okay? Pwedeng iwanan na lang. No? And then just observe. Kung lumaki, then that's time you remove it. No? Now, if you have to remove it, there are two options, incision and drainage and excision. So incision and drainage, you just put a small cut on the cyst, no, not the entire length or width of the cyst, malit lang, and then, especially doon sa opening, sa punctum, then gently squeeze out the content without removing the capsule. Hindi mo tatanggalin yung capsule. So, since hindi mo tinatanggal yung capsule, it may recur. But as I said, it's benign naman yung you can let it pwede mong iwanan mo na, no? And then if it recurs, then it recurs. Pwede naman i-squeeze again kung nag-recur. Okay? Paulit-ulit lang pag-squeeze, no? Pero kung pag lumaki ng husto, then you remove it na. You have it removed by excision. So when you do the so-called excision, you remove the entire cyst together with the entire capsule. Kasi pag yung capsule hindi natatanggal, nagre-recur. So when a surgeon does the excision type of operation, there is lesser chance of recurrence. Okay. So the basic difference between incision and drainage and excision is that in excision, tinatanggal yung buong capsule, kaya lesser chance of recurrence. Dito sa incision and drainage, hindi tinatanggal yung capsule, yung content lang, pinapalubog lang yung cyst. No? So, do they recur after an operation? Yes, it's still always possible. It can recur, but it recurs very quite often with incision and drainage alone because we don't remove the capsule. Okay? Pero pwede na kung malilit lang, no? Hindi ka naman, it's not causing any discomfort. You don't, para wala ka ng mga cut, wala ng operation, you just have it squeeze out. Okay? So ito example, may scar dito, no? This scar. So it means that this was previously operated and then there was a recurrence of the cyst. So these are some images of epidermal cyst. Okay. So usually a palpable mass. Minsan di mo makikita, medyo flat siya, but there is a mata, a punctum. So once there's a mata there, you start thinking of epidermal cyst. Because this is a picture of the entire cyst removed, kasama yung capsule, no? Okay, buong buo. Okay, buong buo. Pag may naiwan ng capsule during operation, that could be a cause of recurrence. Kaya importante, yung surgeon will make sure that the entire capsule will be removed kung he decided to do an excision para hindi siya umulit. So another set of pictures, there's the punctum, ito yung punctum, and then ang incision pag ganon, okay, and then iyon, tinitingnan, ito na yung punctum, okay, at ito yung cyst itself, no, and then ito lumalabas na yung some of the substances of the cyst. Kumisan habang ino-operan, pumuputok yan, no, mahirap kumisan ibuo ng pagtanggal, no. Okay, so after showing the content, greasy material removed, no, from the skin. Another set of picture. Ito with a small incision, natanggal lahat, no? So depende sa size ng epidermal cyst. Kung maliit lang, pwedeng maliit ang incision and then tanggalin ang buong cyst, no? Epidermal cyst near this breast, kasi kamisan pag may bukol dyan sa breast, akala natin breast mass, matatakot na tayo. So we must know how to recognize epidermal cyst on the skin. Pag epidermal cyst on the skin of the breast, malapit sa breast, yun lang, huwag ka na kayo matakot if you know how to recognize it. If you don't know how to recognize it, sasabihin nyo, ay, may bukol ako sa breast, yung pinaka-breast, no? Kaya baka sabihin nyo, baka cancer yan, no? Ano, na matatakot kayo, no? So a lot of times, epidermal cyst can occur, as I said, it can occur anywhere, pwede dito sa breast area. So an example here, dito may cyst dito sa skin, nipple. Okay, kung di niyo kabisado yung epidermal cyst, matatakot na kayo. Ay, sabihin mo, may bukol ako sa suso, sa breast itself. But it's a bukol sa balat. Okay, magkaiba yun. So ito, showing discrete superficial intradermal means just beneath the skin with a punctum and an opening. Then dito may konting mapula-pula, kaya kung may mapula-pula, this would suggest that there is some inflammation going on already, no? Okay, so ito may nana na nilabas, talagang may infection, no? Okay. And then, after removal of some of the nana, now konti lang naman, so the surgeon decided to remove the entire cyst, tinanggalin buo, para kumisan, yung infected na cyst, mahirap tanggalin kung may infection. Ang gagawin na lang, basta matanggal lang yung nana, and then i-evacuate lang yung content muna, para makontrol lang infection. Pag nag-heal na infection, you wait for probably 3 months, 4 months, 6 months, kung umulit yung cyst, this time, wala nang infection, pwede nang slowly tanggalin yung buong mass, no? So fortunately for this patient, after removal of yung nana, natanggal naman yung yung cyst together with the capsule. Kasi pag may infection, mahirap hanapin yung capsule, no? So, ganon. Ito yung ano. Okay. So, epidermal cyst is not common in the breast area, but if it occurs there, if you know how to recognize it, hindi na kayo matatakot. Okay. Epidermal cyst on the breast area. Remember, I use the word area, not within the cyst. These are not breast cancer. Okay. So treatment of epidermal cyst on the breast area, pwedeng excision, pwedeng incision and drainage, kung maliit na maliit lang. More images. Ito yung sinasabi kong incision and drainage, konting hiwa lang, konting lakihan lang yung butas, yung opening, yung mata, and then squeeze out mo na lang yung content. No? But so this is a kind, the operation here is the incision and drainage. So higher chance of recurrence. Pero most, kung minsan binabaliwalaan na lang natin ito kasi Pinay naman, then kung umulit, kung talagang kailangan excision, then that's time we excise it. Epidermal cyst on the face, ganyan din. So usually tinatanggal ito kasi medyo bothersome sa pasyente, itsura. Okay, more so dito, malaki ito. So usually pinapatanggal na nila. No? So nostril, yun. Dito. So natanggal. Okay. And then sa finger, pwede rin. Sa shoulder, pwede ding mag-appear yung cyst. And then sa chest wall, okay, ito lalaki ito, no? So dito sa chest wall, merong epidermal cyst. So that's practically the whole of my talk. So I have discussed the following: what is an epidermal cyst of the skin, the hypothesized cause, difference between sebaceous cyst, epidermal cyst, and acne, where are they usually located, what is the most common complication of epidermal cysts if not treated, how to recognize, what is the treatment, and do they recur. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on epidermal cysts. Knowledge is power, it gives power. Use of the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on epidermal cysts in your health management. So with that, I end my pep talk on epidermal cysts in the skin. I hope I have empowered you to have an essential understanding of epidermal cysts in your health management. So before we go to the Q&A portion, reminder, please take the Olete. The link has been placed in the chat box. And then 50 Olete certificates will entitle one to a free voucher for a ROJoson telemedical consultation. And then feedback, please type in your feedback in the chat box before we adjourn. Okay. Let's now have a group picture taking before we start the question and answer portion. Okay. Okay. All set? Who wants to be included in the picture? Okay. All set. There's one more box. It's empty. No person. Okay. One, two, 1, 2, 3. Okay. I just save it. Okay. So the floor is now open for questions, comments, sharing of experience, or consultation. Now, short consultation. Okay. Who wants to start? Who has an experience with epidermal cysts? Who has an experience of the difficulty in trying to differentiate epidermal cysts from other types of skin tumors or below the skin tumors? Anybody? How many have epidermal cysts before sa katawan ninyo? Wala pa? Epidermal cyst is quite common. Wala? Perla, you want to say something?
Yes, Doctor.
Oh, sige, Perla. Unmute yourself. Unmute.
Wait, Doctor, wait. Okay. Mute.
Unmute.
Okay na, Doc?
Yeah, okay na.
Last month, nagpunta yung kapatid ko na galing sa probinsya.
Oo.
Kasi meron siyang cyst sa may puwet, ba yun? Nagpatingin kami sa surgeon dito sa amin, doktor, sinabi niya is something like sebaceous cyst.
Okay. Okay.
Nirecommend niya for operation.
Okay. Okay.
Pero ang sabi niya, pag hindi daw maopera, pabalik-balik din yun kung halimbawa mag-antibiotic siya o kuwan. Pero hindi pa niya inopera kasi sabi niya pagbalik na lang daw ng kapatid ko. Pero tinanong ko kung parang urgent naman na maopera, hindi naman daw po.
Okay. So, anong gusto mong sagot? Anong tanong mo?
Kung talaga nga kaya ng sebaceous cyst yun, yung ano ng doktor, diagnosis niya. Kasi parang malaki na rin parang bilog na ng ganyan.
Nakita ho ba ninyo?
Opo, nung pinaano niya sa pinahiga niya.
Nakita mo?
Nakita ko rin.
Oh, sige.
Opo.
I-describe mo sa akin based on what I have lectured. Kasi
Parang bilog siya.
pag hindi ko nakikita, mahirap sabihin. Tama? Okay.
Opo.
So, ikaw mag-describe sa akin para
Bilog siya. Bilog siya, doktor. Tapos parang medyo may malaki na rin kasi nga sabi niya yung ate ko hindi niya inaano noon, hindi naman niya pinapansin pa hanggang na pag umupo na siya, siyempre dito sa may puwetan niya, parang masakit na kasi naano na dito sa may upuan eh. Sabi ng doktor nga, yung surgeon, parang ang laman lang niya, parang sebaceous cyst nga po, parang sa tagihawat daw po yun.
Sige. So, kanina sinabi ko nga sa iyo in terminology, no? Marami pa rin yung mga doktor gumagamit ng the phrase sebaceous cyst, no? Okay. So, strictly speaking, hindi ho tama yon, no? Ang proper term noon, epidermal cyst, no? Epidermal cyst. Anyway, ano lang, may misnomer lang pero essentially pareho epidermal cyst siya, no? Okay. Most likely kung talagang may mata ho ba? May mata?
Parang doktor kasi pinisil-pisil naman ng surgeon eh. Sabi niya, ano na lang to? Sabi niya, yun nga, sebaceous cyst. Parang tagihawat lang ito ang laman. Yun lang sabi niya, doktor eh.
Hindi nga. Aside from getting clues from what the doctor says, no? I'm trying to get clue from yung observation mo dun sa bukol. Okay, number one, nasaan naka-locate yung bukol?
Dito sa may, di ba mayroon yung pisngi ng puwet, doktor? Doon sa baba niya, di ba parang di ba yung round na ganun? Parang dito sa baba niya.
Malayo sa puwet?
Malayo naman. Parang baba lang niya eh. Opo.
Ate mo ito, no? Ate mo?
Opo.
Malapit to sa puwerta, na? Malayo sa puwerta.
Malayo naman, doktor.
Okay. Gano'ng kalaki?
Parang something na parang pollen ba yun? Pollen na kaya?
Okay.
Opo.
Pollen, mga
parang ganito na eh. Parang ganito na
kung
ba yun?
pollen, mga 1.5 to 2 centimeters lang yan. Okay?
Opo.
And then, sa kapamo, sa tingin, I'm relying on you na ha, kasi mababaw lang ba? Nakausli ba? Nakausli?
Nakausli, doktor. Nakausli yung bukol.
Okay.
Parang nakaganon siya.
So walang sugat yung balat?
Wala naman.
Walang break? Okay.
Wala po.
So kung mababaw at nakausli siya, parang nakaumbok siya, no? Nakaumbok.
Opo, nakaumbok, doktor, nakaumbok.
Okay. So most likely, ito walang punktong ito. Kadalasan yung sa puwet, baka sa batak, baka commonly, ang experience ko, kung minsan walang mata. Pero epidermal cyst pa rin. No? As I
Oo
said,
nga, wala ngang mata, doktor, yun.
okay. Sabi ko, majority have punctum. Pag may punctum, 99% ano na siya, epidermal cyst. No? Kung walang punctum, based on the kapa, kung epidermal cyst ang diagnosis mo, you can only say 90% certain ka. Okay?
Opo.
Walang punctum, no? So most likely epidermal cyst siya, no? Okay? So pwede siyang ito yung mga gano'ng katagal na 'yon?
Matagal na rin daw, doktor, eh. Hindi lang niya iniinda, eh.
Ayan. Kung matagal na kasi kung epidermal cyst usually benign na 'yan, no? Ang magiging possible complication lang naman noon, magi-infection lang, di ba? Pero
Opo.
hindi naman madalas 'yon, no? So, ang pwede niyang gawin kung naistorbo siya, pwede niyang patanggal, local anesthesia, no?
Opo.
Or yung tinatawag na incision and drainage, no? Pero kung parang Holland na, tanggalin na lang pati yung buong capsule para hindi umulit. No?
Yung sabi ni surgeon, doktor, is outpatient daw siya pag pinaoperahan niya.
Outpatient lang yan. Kahit na,
Opo.
minsan sa clinic, pwede, no? So,
Opo.
lagyan ng anesthesia, based on yung pictures na I flashed the pictures earlier, gano'n, makikita mo, no? Okay?
Opo.
Okay?
Okay po, Dok. Thank you po, doktor. Kasi takot nga yung ate ko noon, baka daw, cancer na yan, natatakot nga po siya, eh. Siyempre, bukol po yun, eh. Kaya, pinatingnan namin sa surgeon, yun nga ang sabi nga ng surgeon.
Ngayon, after listening to my lecture, no, i-correlate mo sa nakita mo,
Opo.
sa ate mo.
Para hindi siya,
Sure ka na. Sure, more or less, pareho yung sa sinasabi ko.
Para, kaya nga ako na mag-attend kasi, ganito yung ate ko, mag-attend nga ako, magtanong ako kay Doc.
Sana yung ate mo, pina-attend mo.
Nasa Ilocos, doktor.
Pwede naman yung Zoom sa Ilocos, ha?
Ay, di ko na sabihan.
Pwede, kahit saan. Ako nga, galing ako sa Tayabas, muntik na, kung minsan nagre-lecture ako sa Tayabas, sa Quirino, di ba? Pwede.
Oo nga, nakalimutan ko, doktor.
Kahit nasa abroad.
May edad na kasi yun, baka hindi niya alam yung mga Zoom, hindi niya marunong. Siyempre, mga may edad na.
Turuan mo na lang.
Opo, pag pumunta po dito.
Okay, so.
Okay, thank you, Doc. Thank you, doctor.
And then, okay, the other comment before, may comment. Tapusin ko lang yung kay Perla, no? Perla. Kasi this is a common observation, no? Ano yung, kasi sabi niya kanina sa umpisa, may cyst yung aking kapatid, no? When you say cyst, ang cyst kasi, ang ibig sabihin ng cyst, yung laman nun may fluid, hindi siya solid, no? Ito may parang pasty fluid na yung malagkit, no? Okay, yung sa epidermal cyst. Pero kung bukol, ang umpisa na pag-describe kung anong problema, sasabihin mo may bukol. Then after that, kung malambot, no, at mukhang may fluid, that's the time you call it cyst. Pag hindi siya itsurang may fluid, you don't call it cyst. No? Pero the layman palagi sinasabing, may cyst ako. No? Okay? So, the correct term there is bukol na lang. Sabihin mo na, may bukol siya. May bukol ako. May lump. No? Okay? So, after na makapa mo pa yung bukol at sabihin natin may tubig, that's the time you use the word cyst. May cyst. Okay? Ganun yung mga terminology ng mga doktor, eh. Pag sinabing may cyst siya, ang inutukoy namin, may bukol na tubig ang laman. Tubig ang laman o kaya pasty fluid. Na? Okay? Any more
Okay,
questions?
Doctor.
So any person who has epidermal cyst before?
Sir, may isi-share ako. Kay Christy po Wait lang. May isi-share akong picture. Tinatanong niya kung epidermal cyst daw
Sige.
yan. Nasa chat natin.
Picture?
Oo. Yan ano.
Okay. Okay, everybody look at the picture. Can you see the picture? When I see the picture, ini-imagine ko na saan ito. Sa kamay ba ito? Sa paa? Sa ano?
Sa kamay niya, sa arm dito, sa ganito.
Yan.
Buksan mo yung ano mo.
Ha? Ikaw, si Christy.
Yes, Doctor. Ayan.
Okay.
Pag pinipisil po siya, lumulubog po siya, pero hindi naman po siya masakit.
Lumulubog siya. May mata?
Opo. Wala. Parang wala, Doctor. Parang wala naman. Basta parang ano lang siya, parang pimples na malaki.
Walang mata.
Wala po. Parang buko lang po talaga siya na maliit. Pero pag pinipisil nga po, lumulubog siya, tapos hindi naman siya matigas.
Na-flat pag pinipindot mo? Nagpa-flat?
Wait lang po, i-check ko po. Parang ganun po, Doctor. Bumabalik siya.
Andali, tingnan ko nga. Speaker. Paano kung ano? Sige, pindutin mo nga.
Wait po.
Sige, pakita mo sa camera.
Ay, paano ko ba? At paano ko ba iya? Dito po.
Madilim.
Lumulubog lang siya, Doctor. Tapos bumabalik talaga.
When you say lumulubog, yung buong buko lumulubog. Hindi yung...
Yes po. Parang, pag pinisil ko po siyang ganyan, wala, nagpa-flat lang po siya.
Sige, pindutin mo. I-close up mo.
Paano po
Sige,
ba?
pindot. Yan. Lapit mo lang sa camera.
Okay. Wait lang po.
Gitna mo.
Gitna. Nasa na ba?
Outside the camera ka eh. Outside.
Wait, Doctor.
Tama na kami. Ano ba ginagamit mo? Cellphone?
Ay, kamay nga. Nagdilim eh. Kita. Parang hindi. Sir, kita na po.
Hindi mo sinesentro sa camera eh. Sentro mo sa camera. Sige pa, sentro mo. Hindi namin nakikita. Yung camera. Yan. Okay, hindiin mo.
Yun lang siya.
Oh, okay. Epidermal cyst yan kasi ano siya, nakaumbok siya, no? Kasi kung well defined kasi siya eh. Kung yung lipo kasi another consideration lipoma, yung taba, no? Okay. Pero yung lipoma usually flat siya, medyo parang Hindi siya yung hindi siya ganito na ano, yung maumbok, clear ang maumbok, usually konting may tapering sa side. May tapering sa side, no? Okay. Anyway, mukhang epidermal cyst din yan, no? Kahit na walang mata, no? Okay. Okay. So, okay, ikaw, gaano katagal na yan?
Siguro ilang,
Taon na?
parang to doctor, mga 3 years na po siguro to. Pero ganito lang naman po siya, hindi naman po lumalaki.
Okay. So, and at least we know it's not cancer. Number 2, kahit na hindi pa natin sure kung ano siya, lipoma or epidermal cyst or something else, no? Now, kung di ka naman istorbo, pwede mo i-observe kung ano ka na anxious ka na, patanggal mo na lang.
Doktor, halimbawa sa Tuesday, pwede po ba ito ipatanggal sa clinic lang?
Madami akong schedule sa Tuesday.
Hindi, kahit kailan na lang po, kung kailan po
Walang
pwede.
ano, tsaka book na lang natin. Book na lang natin para sa, okay?
Okay po.
Hindi mo nag-aapura yan? Okay. Okay, hindi mo nag-aapura.
Thank you
Okay.
po.
So, any more questions? Any more? Yung i-diffuse, yung mga 2 common tumors or bucles sa mga ilalim ng balat, dalawa yung pinaka-common will be epidermal cyst and lipoma. Lipoma means yung mga tumor ng taba, no? Yan ang one common din yan, no? So, kadalasan madali ma-differentiate between the two using the punctum as the basis. Kung may punctum, epidermal cyst kagad ang diagnosis. Kung walang punctum, kadalasan lipoma, pero kumisan pwede pa rin epidermal cyst, na? Okay. Pero yung lipoma hindi rin siya cancer, no? So we must know how to differentiate the two, no? Para hindi tayo palaging natatakot. Sabi mo, ay, natatakot ako, baka cancer, no? Ganun, no? So that's part of our patient empowerment, no? Okay. So wala na mag-share. Walang may at least meron tayong isang participants na may nakikitang bukol na parang epidermal cyst. Meron akong isang theory na kasi ang cause ng epidermal cyst usually dead skin ang pumapasok, no? So when you say dead skin, mga libag ito libag, no? So ang question ngayon, mas maganda ba tanggalin ng mga libag? Kasi yung libag mahirap tanggalin na lahat, di ba? Hindi na nauubos. Everyday meron, di ba? So when you take a bath, ikuskus na lang yun ng husto, bawasan na lang yung load ng libag, no? Para mabawasan lang, no? Okay. So yung mga nasa likod, madalas din may mga epidermal cyst sa likod kasi sa likod mahirap abutin, di ba? Yung mga scrubbing the dead skin, no? So usually inaabot ko lang yung likod ko, ini-scratch ko with my kuko, no? Pero yung iba gumagamit ng brush, di ba? Yung mga brush para mabawasan lang yung mga dead skin. Okay. So I don't know, that's my theory lang naman 'yon, no? Okay. Paano pag-iwas na mga dead skin sa likod, yung mga epidermal cyst sa likod, na? Okay. Okay. No more questions? So,
Doctor, what about boil? Yung pigsa. What is it? Epidermal or sebaceous cyst?
kung when say boil, yung mga ano sabi mo? Pigsa,
Or, yeah, pigsa. What is the consideration? Is it epidermal or sebaceous cyst or what?
okay. Yung boil is usually infection ng hair roots. Hair roots yan, no? Okay. Yan may nana, walang capsule yon. Kaya pag pumutok, Pag natanggal yung nana, hindi na siya uulit. In that, I mean, hindi tulad sa kung epidermal cyst, no? Pag may nana at pumutok, ando pa yung capsule, uulit lang siya. No? Okay. Pag boil, kasi hair follicles lang yan, isang buhok, nagkaroon ng infection. So kung pumutok na yung boil, matatanggal yung nana, usually hindi na umuulit yon, no? Okay. Okay. So yung mga ganon, we don't use the word sebaceous cyst anymore. Epidermal cyst, no? If you want to differentiate between boil and epidermal cyst, no? Okay. Okay. Any more questions? Wala. So ako magtatanong. Lorly. Si Lorly ang ano. Lorly. Lorlier. Oh, Phoebe. Phoebe. Wala. Absent. Okay. Si Mary. Mary na lang. Mary. Mary.
Doc, in terms of, kasi may kinalaman ba sa diet or mana-mana, meron ba?
Diet, wala. Yung mana-mana, in a sense, pwede because of parang prone to such a epidermal cyst because of genetic predisposition, na mga tendency, na so theoretically pwede kasi may mga tao na yung pamilya ang daming merong epidermal cyst, di ba? Okay. So pero kahit na walang family history, pwedeng tamaan ng epidermal cyst, no? Okay. At usually yung sabi nga nila, although it's still a theory, no? Yung epidermal cyst, sabi natin, parang nagpumasok, somehow, for whatever reason, pumasok yung mga dead skin sa loob ng balat. Na? Okay. So the question is, how did it happen? Di ba? Paano pumasok? Di ba? Yan ang tanong. No? Pero at the moment, we don't know the exact cause kung bakit papasok siya. No? Pero it's proven na kasi nung pag tinanggal yung cyst, in-examine nila no? In-examine nila, nakita nila may dead skin doon, no? Okay. So kaya lumabas yung theory na pumasok yung dead skin from the surface sa loob, no? Ang tanong ngayon, bakit siya papasok? Di ba? Yan ang tanong, no? Okay. Kaya nga sinabi rin nila, misnomer yung sebaceous cyst. Kasi yung original, yung popular term dyan is sebaceous cyst. No? Now, a certain author, sabi niya, mali yata yung mga doktor namin. No? So, in-examine niya yung sebaceous cyst under the microscope, nakita niya dead skin pala yon. Hindi siya sebum, hindi siya mga oil, hindi siya mga parang substances from the oil glands of the skin, yung mga hairs, no? Ganon, no? Yeah, they say it's the proper term is epidermoid cyst. Epidermal cyst.
Kasi di ba like scrubbing, Doc, like you said, scrub your back or ganyan. Maraming mga derma sinasabi, don't scrub your skin too much. Di ba mga derma, scrubbing.
Usually they don't because they will say protective yung mga dead skin, di ba? Yung mga dead skin, protective din yun. Parang yung mga face, wag mo tatanggalin lahat ng oil, di ba? Okay. Kasi protective yung mga oil sa mukha, di ba? Okay. So, yung ganun din. But we know that there's a condition that will lead to implantation or invagination of the dead skin to the nangyayari yon. So what do we do? So probably bawasan ng konti na lang, I don't know. Kaya sabi ko, hypothesize lang yan hindi siya talagang proven, no? Okay.
Thank you, Doc.
Okay. So just so you know how to recognize epidermal cyst na? Merity? Merit leave.
Yeah.
Sige nga.
Dok,
Super.
sana you also take up yung about acne kasi yung mga malalaking tigyawat na infected.
Sige, tsaka na lang kasi hindi ako derma. Okay.
What
I,
is
I
the
will, I will try to see if I can have a talk on that late, but not this year. Baka ang susunod, not yung as I said, a more common na bukol sa underneath the skin lipoma, no? Okay. So I might give a talk of lipoma November na lang, November, no? Kasi Breast Cancer Consciousness Month ngayon, hahabulin ko lang yung mga lectures on breast cancer, no? Okay. Tapusin ko muna yung breast cancer. Then, yung lipoma, I will give the lecture on lipoma bandang November. No? Okay, I promise that. No? Okay.
Thank you. Thank you.
Okay. So, if there are no more questions, basta epidermal cyst, to recognize it, may bukol sa underneath the skin, no? And then may mata. Okay? Basta yung mata is the giveaway, no? Kaming doktor, pag nakita namin may mata, most likely 99% epidermal cyst na yan. Na? Ganon. Na? Okay? So, if there are no more questions, we'll call it a day. We'll see each other next week. Na? So, the topic will be, anong topic yun? On breast self-exam. Why I must do it? Why a must do for all Filipina. Breast self-exam, okay. A must do for all Filipina, okay. Then we will connect it to the breast self-exam award. Okay, tatapusin na natin yung award by next week, no? Okay. Okay. No more questions. We'll call it a day. We'll see each other next week.
Doctor, can I
Yeah.
say something? Baka gusto niyo pong umattend kasi si Dr. Karen Timbol, pinadalahan ako ng invitation. Meron kasing yung para sa Cancer Consciousness Week, meron silang meron silang affair. This will be at Manila Doctors on October 15, I think. Yeah, October 13, 1 p.m. to 5 p.m. sa MDH Penthouse. So they are inviting cancer survivors to grace the occasion.
Ano yan? Lay forum?
Hindi, may mga activities, hair cutting, Zumba, yun. Yun ang kanilang activity.
Anong title?
The title is Bending Without Breaking. Flourishing despite cancer.
Okay, so parang exercise, parang ano?
Yeah,
dance.
there is an activity 1 to 5 p.m. Meron daw, yun nga, Zumba, hair cutting, and then games, yun, and free food. That's all. So if you want to join in the Cancer Institute of Manila Doctors, you can go there from 1 p.m. to 5 p.m. October 30.
Ano, Maria? May nag-boomerang? Nag-echo, ano ba yung So 13, October 13.
Yeah, 1 to 5 p.m.
1 to 5 p.m. Okay, so that's
MDH Penthouse.
sige.
If you're just interested, kasi pinadalhan na ni Dr. Timbol ng invitation.
Okay. So this is for you, not for me. Okay, kung interesado kayo, mag-attend ho kayo, no? Okay. Okay, so let's call it a day. We'll see each other next week, no? Okay, bye-bye.
Thank you, Doc.
Thank you, Doc. Bye-bye.
Thank you, Doc.
Bye-bye.
Doc.
Bye-bye.
Thank you po.
Okay.